it's Kristen. Welcome back to my channel. If you are new here, I am in my third and final year of a Doctorate of Physical Therapy program, and I have been vlogging and documenting my journey since my very first day of physical therapy school, so it means so much to me if you could take a second and subscribe down below. So I currently am in semester 7 of 8, and it is one of my 3 full-time clinical rotations, and I currently am in the hospital and acute care, so I thought I'd film a video today sharing my kind of hospital essentials because I am there for 10 hours, so I have to bring a lot of stuff with me and a lot of different stuff than I have to for outpatient. So without further ado, let's get on into it. So my very first essential obviously is going to be scrubs. I have to wear black. I only got a few pairs because I work 4 days a week, like I said, so I don't need many. I can easily wash them before my next shift, but I just picked up this new pair from Dolan Scrubs. I will have them linked down below, but they are so cute, you guys. They are such high quality. They're equal to, if not better than, my figs for a little bit less of a price, and they do 15% off your first order. And look how cute they are. They have these cute little motivational words kind of on the side pocket and on the back. They're super flattering with the neckline and the kind of cute puffy sleeve here, so I'm absolutely obsessed with them. My new favorite pair of scrubs for sure. And they have 7 pockets, which is so important. I will get into everything I put in my pockets in a second. Absolutely have been loving my Dolan scrub, so definitely get a pair. Next essential is an under scrub, which this isn't something I even thought of getting. I had one because I ordered the figs like starter set, and it was tops, bottoms, and an under scrub, and I realized how freezing the hospital is. So I have this one from figs, and then I had to pick up a second one because I decided I can't not wear an under scrub to the hospital. It's so cold. It's kind of gross to have your bare arm exposed if you're like rolling a patient over, touching their skin. So that too. This is from Healing Hands. It's the same exact as the other one, but just got 2 plain white ones, and I think they're absolutely a necessity. Even though I'm a small in the fig scrubs, I wish I got a medium in the undershirt. They do run small, just an FYI. Another essential for me would have to be headbands. If you didn't know, you have to wear your hair up in the hospital, so I bought some headbands to kind of spice it up. Favorite ones are from Maven Thread because you can kind of wear them wide, or you can kind of fold them up in half. They're sewn in the back. So this one's from Maven Thread. This one's from Maven Thread. And then I have these 2 from Amazon. But I tend to wear a headband like almost every single day, and then I wash it after my shift, obviously, but I feel like it just makes me more put together. And we have to wear protective eye goggles when we go into the patient's rooms, so it's really easy to kind of like flip them up on my head while I'm walking, rest them on my headband. And speaking of washing things, my next essential is very new. I just got it last week, but it is the Lysol laundry sanitizer 0% bleach. And you wash your scrubs with just normal detergent, and then you put like a cap full of this in, and it's supposed to kill like all of the cold and flu viruses, specifically the COVID-19 virus. So I saw this on TikTok actually, so it inspired me to buy it, and who am I to say if it is really working or not, but it just makes me feel better knowing that there's kind of something strong in there to kill all the gross hospital germs we are working with. And I do always wash my scrubs separately. As soon as I get home, I put everything I wore that day, headband, socks, bra, underwear, scrub, under scrub, in the laundry room in a trash bag, and at the end of the week I wash it all with this guy. Call me basic, but my next essential is my Clove Shoes. This is not sponsored. I know they sponsor a lot of people, but I purchased these with my own money, and I have gotten so many compliments on them. And my clinical instructor, we have been in multiple rooms where bodily fluids have gotten on our shoes, and I have just been able to wipe them off with a bleach wipe, not gotten my shoes wet or anything. And he just wears normal like on cloud sneakers, and a lot of nurses and people I've noticed just wear normal sneakers in the hospital. But if there's fluids on you, that's gonna soak right through your shoe and get into your sock and on your skin, and that's just disgusting. So definitely get Cloves or some sort of like waterproof sneakers because they have been a lifesaver, and they're super cute and they're super comfy. So I definitely recommend them. I'm not going to show them because they're kind of gross. Obviously I take them off, leave them at the front door wipe them down, so I'm not about to hold them up with my bare hands right now, but I will insert a picture of the ones I have here. Our next essential is badge reels. So this is the one I use the most often. It's from the Badge Babe Boutique, and it has these cute like flower tulip things on the stretchy part, and then this part is interchangeable. So I have this cheetah one that you can interchange out. Ignore my gross nails right now. I really need to paint them. This one came with my clothes. Honestly, I never use it because it's kind of boring. And then I have this little sunflower one. So I kind of change them out like every week or so. Makes it fun since you have to wear plain black scrubs. Might as well spice it up a bit. My next essential is my mini memo notebook and pens. You can never have enough pens. If you think you have enough, you don't. I have lost so many pens in patients' rooms, so get like 2, 3, 4, 5, stick them in your pocket, stick them in your bag, because you do not want to be in a patient's room and not have a pen to write down their history and their examination findings. This notebook is a lifesaver because it fits in your pocket, obviously, and I write down a ton of stuff in it. Before I started my rotation, I kind of wrote a bunch of cheat sheets in the front of my notebook. Like I wrote like the typical precautions for like total hip, total knee, abdominal, sternal, spinal. Just as a quick reminder, I wrote out all the levels of assistance, like dependent, max, mod, min, contact guard, what classifies those, the differences between the different discharge settings. So I just wrote a ton of notes to myself here, so that is coming in handy many times. I write down like the passwords to different closets that I need to get into. I write down like the patients I saw that day, what I did with them, because I need to log all my patients. I'm almost done with this notebook. I need to get a new one soon, but definitely recommend this, especially if you're in the hospital. I had it in outpatient, didn't really use it because you can use like normal paper, but in the hospital, this is an essential. Going off of that, another essential is a clipboard, and it's actually in my locker right now at the hospital, but I do not have one of those cool little folding clipboards that can go in your pocket. I thought about ordering one, but they're kind of pricey, and I'm almost done my rotation. I have 6 more weeks, so I don't really know if it's worth it, so I'm just gonna keep using my regular clipboard for now, but I almost always leave it in a patient's room. So if you have a rotation coming up and you haven't started yet and you have the full like rotation, I probably would purchase the folding one, but I print out my patient list for the day, and on there I write kind of like the time in, time out, and the examination findings, typically right on that sheet. Next essential is my Apple Watch, specifically my Apple Watch set to military time, because all the notes you have to document have to be in military time, and before you go into every single room you have to write down the time, and when you leave the room you have to write down the time, so you definitely need a watch and set it to military time if you can. Next essential is caffeine. I don't drink these every day because I know they're not good for you, but Celsius just tastes so good, and if I wake up and I'm super tired in the morning, I will have a cup of coffee, obviously, and then I will pack a Celsius to have either at lunch or later in the day, because I can just feel it's gonna be a long day, you know, so I like to have these on hand in my fridge in case of emergencies. I also really like the Verb energy bars that have like espresso in them. I'm actually out right now, I need to get some more, but I always have those linked down below to try them out. They're like these little cute mini bars, and they have caffeine in them, so those are also great if you are looking for a quick caffeine. And my last essential is snacks. When you're at the hospital for 10 hours, you are going to get hungry if you have lunch at 12 and you're there till 7 p.m. So I always bring tons of snacks to have as I'm like documenting or something. Specifically, I have been loving these Perfect bars lately. I found these at Aldi. I know they sell them other places, but at Aldi they had these like baby snack sized ones. So these are super quick to pull out of the fridge and just have quickly as you're documenting, and they have a good bit of protein in them to fill you up. But really, any snacks will do. And those are all of the essentials I wanted to share with you guys. If you have any questions at all, be sure to leave them down below. And thank you so much for watching, and I'll talk to you guys in my next video. Bye!